Hi everyone, Mr. Brumble here, back again. One final little video with your vital signs, and that's with regard to blood pressure. I got a couple of tips for you there. We're going to take a look at where you actually listen on the mannequins to take your blood pressure. I'm going to talk a little bit about being gentle with the equipment, especially the valve on the inflation bulb. We're also going to talk a little bit about the way you look at the gauge to make sure you get an accurate reading. And then the last thing I really want to encourage you is that when you release the pressure, when you're starting to listen for sounds, I want you to do that very, very slowly and listen very, very carefully. Upcoming is a little video that'll actually show you some of these things that I've just talked about. Hope this helps you in taking blood pressures. Okay everyone, here we are back at our mannequins. We want to talk a little bit, as promised, about taking the blood pressures. So obviously, after you learn how to take a blood pressure, you need to know where to place your stethoscope to listen. And so that's always on the mannequin, just beneath the blood pressure cuff, and there'll be a cutout area. If you remember, down there is where you take your pulse. Up here, it's pretty obvious where this speaker is, all right? You'll have several connections that go over to these various connectors on the mannequin. Don't let that bother you. Just make sure you move them out of the way so that you can hear well. A couple of cautions is on the inflating bulb here. You see this little knob? It twists left and right, right and left. You close it all the way down to the right to make sure it's good and sealed, and then you open it to the left to let the pressure out. When you open and close this, do not rack it really hard. That's how these get broken. If these don't move easily, you need to stop and get someone to help you, okay? Because these are easily broken. You'll get some practice with it, but just remember, as I told you in our first introduction, medical equipment should be easy to use. If you're having to really twist or crank on something, you're doing it wrong. And these are one of those devices, so be very, very gentle here. Also, when you're taking your blood pressure, you want to make sure that you line your eyeballs up straight up and down with that blood pressure gauge. And that will give you the best chance of getting an accurate reading. All right, and again, here's where you listen. You see where that is on the context of the arm. Make sure you're very careful with this bulb valve. Nice and gentle, nice and gentle. And then look directly down onto that when you're taking your blood pressure. Hope this helps.